This is an interview with Dr. Grunspan, an internal medicine specialist who has treated patients with neurological diseases for over 30 years. And I would first like to ask you what a stroke is.
Well, a stroke is an emergency and considered a brain attack by cutting off vital blood flow and oxygen to the brain.
And how common is a stroke and what are the consequences?
In the United States, stroke is the fourth leading cause of death, killing over 130,000 people a year, and it also leads to serious long-term disability. A stroke can happen to anyone at any time, regardless of race, sex, or age. However, African Americans have almost twice the risk of first ever stroke compared to non-African Americans.
And are there different types of strokes?
Yes, there are two types of strokes. One is called an ischemic stroke, and this occurs when the arteries are blocked by blood clots or by gradual buildup of plaque and other fatty deposits in the main neck arteries or the very fine brain arteries. This accounts for nearly 90% of all strokes. The other major type of stroke is hemorrhagic stroke, and this occurs when a blood vessel in the brain leaks blood into the brain. Hemorrhagic strokes account for about 13% of all strokes, but they are responsible for more than 30% of all stroke deaths because of their severity.
And what are the symptoms of a stroke?
The symptoms vary depending upon where the circulation to the brain is affected. The brain is broken down into a very detailed map where specific sensations are felt and specific muscle activities originate. Therefore, strokes can cause various changes such as numbness over a specific area, like half side of the face, or even one individual hand. It can also result in sudden weakness in a specific hand or foot and cause inability to walk, for example. Usually, it always occurs on one side of the body.
And what are the risk factors leading to stroke?
The most common risk factor is having had a previous stroke or a previous transient ischemic attack or mini stroke. High cholesterol, high blood pressure, heart disease, atrial fibrillation, sleep apnea, or carotid artery disease. Manageable lifestyle factors like smoking, being overweight, drinking too much alcohol also are risk factors. Some risk factors are beyond our control, including age over 55, being a male, being African American, having diabetes, or a family history of stroke.
And does time matter in seeking treatment?
Absolutely. Timing for an immediate evaluation is critical, as early treatment can change the course of a stroke and even save lives. Early intervention can also decrease disability, which is common after a stroke. Stroke is considered a medical emergency.
Is there a way someone can quickly recognize the signs of a stroke to help the affected individual?
Yes, there is something called FAST, F-A-S-T, which has been developed for people to remember what it represents and how to seek immediate care. FAST begins with F, which is face. Ask the person to smile. Does one side of the face droop? A is for arms. Ask the patient to raise both arms, and if one of them drifts downward, that may be a sign of a stroke. S is for speech. Ask the person to repeat a simple sentence. Does it sound slurred or strange? T is for time. If you observe any of these signs, you have to call 911 immediately.
And what are the treatments for stroke?
The treatment depends on recognizing what caused the stroke to begin with and where in the brain the attack occurred. This is usually discovered by an immediate brain scan performed in the hospital right after entry to the emergency room. If there's a blockage in an artery to the brain, there are blood thinners that can be given directly into the bloodstream to break up the clot. On the other hand, If there is evidence of a bleeding hemorrhage into the brain, other medications can also be given immediately through the vein to prevent further bleeding and prevent damage. Most of these immediate interventions need to be performed within the first 4 to 6 hours of a stroke to have the best effect. Longer-term treatment involves physical therapy on the area of the body affected. For example, if someone's speech is affected, a speech therapist needs to work with that patient to work on phonation and swallowing exercises. If there is leg weakness, for example, a physical therapist needs to have the patient perform specific exercises to strengthen the affected part of the leg. Therapy usually takes weeks or months. It depends on the severity of the damage, but sometimes only partial recovery is obtained. After about 3 months of therapy, very little improvement can be found at that point.
Thank you.
Are there any